Well, welcome back to our Ask Dr. Furlong live Facebook segment. This is the fourth one we've done. We're really excited about today's brief program. We're going to take questions as we've done in the past. If this is your first time tuning in or watching our Facebook live segment, please feel free to send questions in. Also, feel free to share the post as well with people you know so that they can also benefit. One of the things we like to talk about here, obviously, is what we do and how we impact people's lives. And so with laser vision correction and other forms of refractive surgery, we can really, have a profound effect on somebody's life. And I've had the procedure done years ago, and I have a special guest with me today on the Facebook Live segment. This is Dr. Rischel. She is the owner of All About Eyes Optometry. She's an optometrist in Los Gatos. She had laser vision correction by me in 2006, and I wanted to invite her to talk a little bit about her experience today. Hopefully that will generate some questions, and then you guys can learn a little bit about what it's like to go through the surgery as a patient. So welcome, and thank you for coming.
Yes, absolutely. Thank you. Thanks for having me here. As you mentioned, I had LASIK. I can't believe when you said that, over 10 years ago, right? And I'm still seeing great. My vision's still amazing. I can see far. I can see up close. So it really is amazing, and it does affect a lot of people's lives, as you mentioned. So, a lot of times patients come to us as optometrists, they come to us first, right? Because they've been seeing us every year for their exams, and they're interested in LASIK. And so as optometrists, we have a lot of information about that for them. We've been seeing them every year, so we've developed a good relationship with them. We have their history. And that relationship, that history is really important when we're trying to see if they're a good candidate for LASIK. And you guys emphasize that a lot too, right? With co-managing with the optometrist. You ask them a lot, who's your optometrist? We work really closely with your optometrist to help you through this entire process, right?
Yeah, we have. And my philosophy has always been that the more education we can provide to patients, but also doctors of optometry that like to refer patients in to see if patients are a candidate, but also to be their advocate. When the first laser procedures were approved, there was some early skepticism, as there should be, and not everybody was a candidate early on. But when I started my practice almost 20 years ago, I partnered with doctors like yourself to educate them, first of all, and let them know what the technology is, who would be a good candidate, what kind of things we look for, so that you guys can educate your patients and either recommend it or not recommend it. And I know many doctors that have told their patients, I just got to know your eyes, let's wait a year, let's see how things are, and then let's talk about it at your next exam. And I think that's great, because when you've got two doctors working on the patient's for the patient's best interest, we're going to get the best outcomes.
Absolutely, that's right. So do you want to talk a little bit about what that process is like? How do we determine how if a patient is a good candidate for LASIK?
Sure, yeah.
Okay.
Let's definitely do that. Go
okay,
ahead.
so let's you'll imagine with me.
Yeah, I'd be happy to.
Let's imagine that you're a patient at
Okay.
All About Eyes Optometry.
Okay.
And you're coming in for your eye exam.
Okay.
And so at All About Eyes Optometry, we've got a wonderful staff there. And the staff is usually the first ones that welcome you back for your eye exam. So whether it's Adela or Jack or Jose or Isaac who is in the exam with you, they'll ask you, Mike, welcome back. Are you interested in getting new glasses today? Do you want to try the latest in contact lens technology? Are you interested in LASIK? So by the time I'm seeing you for your exam, you might say to me, Dr. Ye, Adela asked me if I was interested in LASIK. And I had been thinking about it. Am I even a good candidate for that? So, we'll go through your exam, I'll check your prescription, and then you've been seeing me for years, so I can see back and see your history if it's stable or not.
Right.
We really want to have a good, stable prescription, right?
Perfect,
Yeah.
exactly, yeah. No, I think it's really important, and you said a bunch of things there that I think are key. Patients trust you and your recommendation, for one thing, because you know their eyes, and then you know through your training who may be a good candidate and who's not, based off of their prescription being stable, being one thing, what the numbers show, because not every prescription can be treated, and then are there any medical issues? We sometimes see patients come in and say, I want LASIK because my contacts are no longer comfortable, my eyes are too dry for them, and now I want LASIK. Well, sometimes that's not a good idea with LASIK, because we know that dryness can be an issue, so we have to address that as well. And you're a great frontline advocate for your patient to then discuss those issues with them.
Yeah, absolutely. So then we'll look at the overall health of the eyes, like you mentioned. We'll check their curvatures to make sure there's no abnormalities, any diseases. And then, as you mentioned, it's a surgical procedure, so we want to make sure that their overall health is good too. So we'll review their medical conditions. We'll look and see about any allergies they have. We'll go over their medications that they're taking. And then if you're a good candidate, I'll say to you, Mike, you're a great candidate for LASIK. Your prescription's been really stable, your eyes are healthy, your overall eyes are healthy, and you're well within the prescription that we can correct.
That's excellent. Yeah, I think that's a good synopsis. And then if you were to send a patient over and say, we've got a patient that's interested in learning more about LASIK, and what we would do is we would bring them into our office. We do some very specific measurements that we use to surgically plan, but then I also take a look at your patient's eyes as well and review their history. And then we talk about expectations, because depending on their prescription or their age, there may still be some things that they need to be keeping in mind as far as their vision and long-term follow-up as time goes by after one of our procedures that's done.
Yeah, and that's important that you mentioned that. That was really nice that you mentioned that. Our staff works really closely with your staff here, and sometimes I'll ask your office to call our patients to say, do you want to, meet the surgeon, right? You go see the surgery center, meet the surgeons, have a little bit more questions answered and feel a little bit more comfortable, and that's a fantastic thing that you have available too.
Yeah, we do that all day long. I mean, we have patients come and check us out and see what their experience would be like. But also, sometimes it's a timing thing too. And if a patient is not ready to move forward with surgery, they at least get introduced to our center. They know that they may be planning in the future for a flexible spending account benefit, which means they might be doing surgery in the new year. Even though we here in the beginning of 2017, we actually have patients say, I'm going to do this in January of 2018 because I didn't sign up for my flexible account in the fall, and I'm going to go ahead and do it this year, so I want to just make sure I'm a good candidate.
Right. There's a lot of questions that patients ask me about LASIK too, and I always like to share the experience that I've had with them. So sometimes they'll ask me, of course, Dr. Ye, you told me that I have some astigmatism. That's a common one, Can LASIK correct that? And, I'm using these contact lenses, or I need reading glasses. Can LASIK correct that? I say, absolutely. LASIK can correct your astigmatism. LASIK can correct your reading up close. I mean, it's really fantastic. Yeah, it's amazing.
And as I alluded to the fact that I had LASIK done, I looked at your prescription recently to remind myself. We actually had a very similar prescription. I was in your range, which we were both pretty nearsighted before we had LASIK surgery done. And mine was almost 20 years ago, and yours was over 10 years ago. The results are stable. We still see phenomenal. Don't need glasses to drive, don't need glasses to read, and the benefits are permanent. They're long-lasting.
Right, and that's another question that patients usually ask me, how long is my LASIK going to last? And then again, when you said that, I couldn't believe it. It's been that long already. So, I mean, it is amazing, Now I know why we're both in the eye doctor field, right? Because you had a big prescription, I had a big prescription. It's nothing like empathy to understand how your patients feel and to share that feeling and why they want to have vision correction.
And it really means a lot to patients when they come in and they find out that their eye doctor has had laser surgery done. Because if they look and they come in the exam room and they see their doctor examining them and they're wearing glasses, they're wondering, well, why are you recommending this to me when you haven't done it? What's wrong with the procedure? Whereas if we're an advocate for our patients, that really makes a big difference. Let's go ahead and get some questions that have been sent in. I'd like to field some of those.
Okay, we have one from Jennifer. She says, if I don't have a regular optometrist and have not been referred, am I still able to come in for a consultation?
Yeah, we do offer a free evaluation to come in and see if you're a candidate. We always ask if you have had a recent eye exam or if you have a regular eye doctor in our area, because chances are we know them, chances are we work with them. And if your eye doctor is someone we don't know or they're new to the area, we will reach out to them and we will find out what their level of interest is in working with us in co-managing patients through refractive surgery. But to get started, if you don't have an eye doctor or you're new to the area, come on in. We can take a look and see if you're a good candidate.
Okay, and here's a question from Nicole. Will I need someone to drive me home after my procedure, and how soon will I be able to drive?
Yeah, LASIK is extremely fast recovery surgery. I mean, I can remember the day I had it done. It was in a morning, and 3 hours later I could look across the parking lot and I could read signs across of the businesses that were there where I had my surgery. So on the day of surgery, you will need somebody to drive you home. It's mandatory just because you've had surgery, your vision's going to be a bit foggy for a few hours, so most of our patients take a little Valium to kind of relax their nerves. We can't have you driving, obviously, if you've taken that, but the next day you'll have an appointment with us, and most of our patients actually drive themselves back to that appointment. Yeah,
I did.
That quick.
Here's a question from Omar. I never had glasses or contacts, but want to improve my vision for sports, specifically tennis. Is LASIK appropriate for this?
Wow, that's a good one. I don't know if we've had that question. When I hear that, I wonder, well, why is he not wearing glasses or contacts for other activities? Omar probably has a very slight prescription that is not bad enough to need glasses for driving, like what the Department of Motor Vehicles will have on your driver's license. So it may be that you were able to pass, maybe your vision was pretty good but not perfect, and it could be improved. If you've not had a recent eye exam or ever had your eyes checked to see, that's worth doing as a first step. You can come here and see if you're a candidate, certainly, but if you've never had an eye exam, that would be the first thing to see. Is your problem with your vision related to the need for glasses? And if it is, we can oftentimes do that procedure for you and improve your sports. Do you sometimes see patients that come in and they've never worn glasses their whole life and they just say, my vision's pretty good, but I want to see better for an activity or an occupation?
Yeah, absolutely. We do see that. You
Yeah.
know, and again, it's like just like you said, we need to do a comprehensive eye exam because we need to see, do they have a prescription? What is it? Is that the reason that their vision is less?
Right.
Is it because of a prescription, or
Sure.
is it because of some other issue?
Exactly.
Health
We have to
issue?
make sure it's not something that's got a different treatment or a different we address it differently.
Okay, another one from Jennifer. Once I come in for a consultation, how soon would I be able to have my procedure, and how long is that consultation?
Okay, so when you come in to see if you're a candidate, we bring you in and we do some measurements and some scans. The full examination in our office is about an hour and a half, and there's some education as part of that as well. If you decide to move forward and have laser vision correction, Fridays are typically our surgery days, so most patients like that because they get the weekend to relax and heal before they go back to work. Our schedule varies throughout the year. There are some Fridays that are more popular than others, but usually within 2 to 4 weeks, we can usually have a patient come in for a consultation, again about an hour and a half, and then surgery can be scheduled really within a few weeks after that.
Okay, and then she's asking, how long will I be in the clinic on the day of the surgery?
On the day of surgery, it's about an hour and a half as well. The actual surgery time is brief. It's about 10 minutes to do LASIK on both of your eyes. But there's some paperwork that you need to fill out, and you'll come in and we'll see if you're feeling nervous at all about the procedure. We offer a sedative that takes about 20 to 30 minutes to work, and then we want to make sure we're taking our time with you so we don't rush you through the process, and then we keep you here for 15 or 20 minutes after the surgery. We want to make sure everything looks good, you have all of your instructions laid out, and if there are any questions, that those are addressed.
And how long is the post-op visit?
So there are several post-op visits. Right after surgery, the one day, there's a visit. That's about 15 or 20 minutes. It doesn't take very long. We're just checking your vision and making sure your eyes are healing well. And then there's typically a visit at about a week, at about a month, and then about 3 months after the surgery.
Yes, absolutely. So, I usually see the patient 1 week after surgery, and at that time, they're seeing fantastic still, right? And they get to donate their glasses now. So that's always a nice thing. We remind them, bring your glasses in. We have a collection box for the Los Gatos Lions group that we donate, so it's really nice. And then they love to go shopping for sunglasses at that time. I mean, it's a really fun time, right? If everything looks good, like you said, then we see them at 1 month, at 3 months, and then every year after that, right? Every year, you're still advocating that they have their eyes examined every year.
And I think that's very important because I use the analogy, if you go and get your teeth straightened or get them whitened and you're looking great with your smile, you're not done seeing dentists the rest of your life. You got to go in and have your teeth maintained and looking for diseases. Same thing with your eyes. We want to make sure you're not developing any other eye problems.
Yeah, so keep seeing your optometrist every year. We want to preserve that vision for years to come.
That's correct.
If I still have questions after my consultation, what is the process for having those answered?
So we actually have several counselors available in person and by phone, but when you come in for the consultation, that's a perfect time to ask your questions of me or Dr. A when you're going to see her. We'll address those questions. If you give us a question we've not heard or we need to do some research, we'll do that for you as well. But if after the process you leave and you're scheduled for surgery and 3 days later you think of a question, email, call, there's ways that you can get a hold of us so we can allay your concerns prior to your surgery.
And how soon after my procedure will I have great vision?
Well, it can vary obviously a little bit from person to person, but generally speaking, the next day you'll be very impressed. It's like you fell asleep with your contacts in or your glasses on and you wake up and you can see and you know you're not wearing them, and that's the exciting part of how fast it is.
How does someone contact your office?
The best way to get a hold of us at my office is furlongvision.com or 800-573-1010. How would they get a hold of you if they live in Los Gatos and they
They'll
don't
give
have
us
an
a
eye doctor?
call. Yeah, they'll give us a call, and they can find us on the web at www.losgatoseyes.com.
Great. So thank you again for joining us on Ask Dr. Furlong Facebook Live event. We will be getting more questions coming in. If you still have some that we haven't gotten to, or you think of a question, please submit it, because we will go through those at the end and we'll answer those online as well. So please watch for us in a future event of Ask Dr. Furlong Facebook Live segment. Thank you.